So, when we talk about things like axial spondylitis, a lot of these types of things are described as this interplay between genetics, microbiome, immune activity. Can you tell me a little bit about how all of those things might interplay amongst each other when it comes to disease presentation and maybe people developing this in the first place?
Sure. So that's a model that we can think about for a lot of different inflammatory syndromes. But yeah, generally, we think that you should have some genetics in place. So the classically described genetic allele for axial spondylitis is HLA-B27, which was described in young men in Minnesota. The axial spondylitis that occurs throughout the world is often not associated with HLA-B27. And frequently in my practice, I see people who have axial spondylitis who do not have this particular gene, but they probably have a gene that we either cannot readily test or has not been described yet. But that's not enough. So, a lot of people, actually, I believe it's 5% of the US population has HLA-B27, and most of those people do not have axial spondylitis. So, the gene needs to be activated by certain triggers. And there's a lot of research and attention looking at mucosal surfaces, particularly the gut for axial spondylitis. So the gut is a mucosal surface that is incredibly large, and on top of that mucosal surface is a collection of bacteria and viruses and fungi and other organisms that are basically living with us and that are immunologically active, meaning they influence our immune system. And there's been a lot of research and time spent looking into what are the disruptions in the gut microbiome that might lead to a disruption in the mucosal surface? And that's important because on the other side of the mucosal surface of the gut and other mucosal surfaces are large aggregates of your immune system. And so when the immune system is abnormally stimulated by possibly an abnormal gut microbiome signature or a disruption to the lining of the mucosal surface, those signals over time can then become generalized to involve other structures away from the gut, including the joints, the spine, the tendons or entheses. And of course, we know with axial spondylitis that its cousin is inflammatory bowel disease associated arthritis, where there is clearly bowel inflammation and clearly disruption to the gut microbiome. So I don't think we know exactly the organisms at play yet. In rheumatoid arthritis, we're starting to understand that a little bit more with organisms like Prevotella copri, which has been described in early RA. We don't have that kind of information yet for axial spondylitis, but hopefully we will soon, and hopefully that will open up some new treatment targets.